With over 35 million Americans diagnosed with diabetes, chances are it's closer to home than you think. But there's more to the story than just numbers. Today we'll dive deep into the world of diabetes, unraveling its complexities and shedding light on its impact. We'll discuss type 1 and type 2 diabetes, exploring their causes, identifying common signs and symptoms, and offering tangible ways to treat and possibly even prevent diabetes.
I'm Professor Megan.
I'm Professor Susan, and we're
your nutrition profs. We are registered dietitians and college professors who have taught more than 10,000 students about health and nutrition. We have answered a lot of questions about nutrition over the years.
Some questions we get asked every year, and some are rarely asked, but very interesting.
We are here to share our answers to these common and uncommon nutrition questions with you.
So bring your curiosity and let's get started. Welcome to our class.
Hello. Thank you so much, everyone, for your support. We love hearing from you, so make sure to rate and review us or send us an email. All right, Susan, what's our question today?
Today, we are discussing all things diabetes. I get so many questions about it from students, family, friends, and coworkers.
It's a really important topic, and I have had many conversations with people about it, too. And I think while most of us are familiar with diabetes and often have family members with it, there's still a lot of confusion.
Definitely.
Yeah.
I get a lot of questions like, what's the difference between type 1 and type 2? And students will make comments like, my grandma used to have type 2, but now she has type 1. Or, since my dad got diabetes, he can't eat fruit anymore.
It's so common, so common. No wonder there are so many questions about it. And we're going to address all of those questions and comments in today's episode. But to begin, let's talk about diabetes impact.
Okay.
More than 37 million people in the U.S. have diabetes. That's 11% of the population. And it's estimated that over 8 million additional people have diabetes but don't know it.
Wow. And the CDC estimates that another, get this, 96 million people, or 1 in 3 Americans, have what's called pre-diabetes. And 80% of them don't know it.
So if you add up those who have been diagnosed with those that have it but don't know it, with those with prediabetes, you get 37 million plus 8 million plus 96 million, which equals 141 million people.
Holy cow.
I know. That's over half of the adults in the U.S.
That's crazy.
Yeah.
It is such a common health problem. The official medical term is diabetes mellitus. It comes from the Greek word diabetes, which means siphon or to pass through. And that probably refers to the excessive urination that occurs with this condition. The term was first used almost 2,000 years ago by Herodotus of Cappadocia to describe symptoms similar to what we know today.
In 1675, the Latin word mellitus, meaning something sweet, was added because those with symptoms had very sweet urine and blood, although I really am not sure how that was discovered.
I don't think I want to know the details.
Me either.
And while this chronic condition is anything but sweet, diabetes is essentially a problem with regulating blood sugar. During digestion, carbohydrates get broken down into glucose or sugar, which gets absorbed in the small intestine, taken to the liver, and then dumped into the blood.
Carbohydrates often get a bad rap, especially these days. Yeah. But they are essential nutrients that we can't live without. Along with fats, carbohydrates in the form of glucose are the primary source of energy in the body. And in fact, our brain prefers to run on glucose.
Yeah. You might remember from the calorimetry episode a couple weeks ago that about 20% of all of your daily calories are used by the brain in the form of glucose. So the body works really hard to keep glucose in the blood 24 hours a day, 7 days a week to feed this and our other really important organs. That's also why the dietary guidelines suggest that we consume consume a minimum of 130 grams of carbohydrates every day.
And don't forget, we also need glucose to make red blood cells as well as DNA and RNA.
Oh, yeah, that's right. It's such an important molecule. Glucose levels in the blood are meant to be highly controlled in a pretty narrow range. Too much or too little glucose in the blood can definitely be problematic.
So here's how this works. After digesting foods containing carbohydrates, blood glucose levels rise to levels higher than the ideal range. This prompts the pancreas to release a very important hormone that you've probably heard of, insulin.
Mm-hmm. Hormones are messengers, and insulin sends a signal to specific insulin receptor cells in the body to remove excess glucose from the blood in order to get back into that ideal range.
So the glucose gets shuttled into body cells, and then the cells can use it immediately as energy to help make larger molecules like RNA and DNA, or if the cell doesn't need it right away, the glucose can be stored as glycogen or fat.
So those with diabetes, they struggle to keep their blood sugar levels in that ideal range. And there are two main possibilities about why this happens. Number one, they stop producing insulin. Or number two, those insulin receptor cells stop responding to the insulin.
So how would you know if you have diabetes? How is it diagnosed?
There are actually a few ways. One is your healthcare provider can check your fasted blood glucose levels. Fasted means that you've had nothing to eat or drink, typically within the last 8 to 10 hours.
This is a really common lab assessment. I actually have this checked every year as part of my regular blood work at my annual exam.
Yeah, me too. But if you don't have insurance, you can often have this test done at a health fair or a pharmacy for free or for a small fee. Ideally, it would be a blood draw from your arm, but even a drop of blood from a pricked finger can give you some good information, especially if you've been fasting.
But a single test like this is not enough for a diagnosis, but it is a way to get a quick look at how you're doing that particular day. The healthy range of fasted blood glucose is 70 to 99 milligrams per deciliter. If your level of blood glucose is more than 100, you'll probably have to do a few more tests to determine if you might have diabetes.
Yes. And in the 1990s, a new test became critical for diagnosis and management of diabetes. It's called the glycosylated hemoglobin A1C test, or just A1C.
This test has been a game changer for diabetes management.
For sure. Hemoglobin is the protein in red blood cells that carries oxygen. As blood glucose circulates in the body, some of it can stick to these hemoglobin molecules. And once it's stuck, it can't get unstuck. It remains attached for the lifetime of that red blood cell. And that's approximately 4 months, 120 days. For this test, you'll have blood drawn from a vein in your arm. So this test measures the percentage of hemoglobin that has blood glucose attached to it.
This is a great way to look at your average blood glucose levels over the past few months, and you don't have to fast to do the test.
Bonus. And it's not just used for diagnosis. It's also used to measure how well a diabetic is managing their blood sugars over time.
So at the hospital that I work at, the blood work maxes at 14%. So if somebody has blood sugar that is very, very high and has been high for several months, it'll just say greater than 14%. And if that's the case, that means that their average blood glucose every day is over 350 milligrams per deciliter.
Wow, so their A1C levels were 14%. What's the goal? Like, what should it be?
So the goal is to keep your A1C below 5.7%.
So 14%.
Yeah.
Is super high.
Yeah.
Wow. A1C is really the most common test that's used now. There are even home test kits for A1C to help those with diabetes better manage their glucose levels. And we know listening to so many numbers on a podcast may be really hard to follow. Sorry, audio only. So check out our infographic on our website, yournutritionprofs.com. We've got the information is there in a visual form.
Some people even develop symptoms of diabetes during pregnancy, and this is called gestational diabetes. So for this, an oral glucose tolerance test is used for diagnosis, typically between the 24th and 28th week of pregnancy.
If you do have gestational diabetes, it can cause pregnancy complications. So you're going to have to make some changes to your diet and go on medication to help control your glucose levels.
Okay, so we've mentioned prediabetes and gestational diabetes, but we haven't even gotten to type 1 or type 2. So let's get into it now.
Let's do it. Okay, let's start with type 1. Type 1 diabetes is an autoimmune disease. A lot of people might be surprised by that. This means that the body's own immune system is attacking the body. And in the case of type 1 diabetes, the beta cells of the pancreas, which are the ones that produce insulin, are being attacked and destroyed.
So no beta cells means the body cannot make insulin. And without insulin, the glucose in your blood cannot be moved into the body cells to be used.
If you have this glucose remaining in the blood, it can clog up your circulatory system, and that can cause impairment of blood flow to parts of the body, especially where blood vessels are particularly small, so like your feet, your hands, and your eyes. We're going to talk more about some of these complications a bit later.
Type 1 diabetes cannot be prevented, and like other autoimmune diseases, we really don't know what causes it. It's thought to have a genetic component, and researchers hypothesize that it's probably a complex interaction between one's genes and the environment. And those are going to be the same for pretty much all autoimmune diseases, including type 1 diabetes. So, Susan, did you know that there are over 80 types of autoimmune diseases?
Really? There are that many?
That many.
I would have never guessed that. I mean, that seems like a lot.
It does. And it's so crazy. The whole concept of autoimmune disease is just one day your body starts attacking a part of itself. It's like a switch is somehow flipped and the body is like, oh no, the beta cells of the pancreas are bad. Attack, destroy.
It is really crazy to think about it that way. Well, type 1 diabetes used to be called juvenile onset or insulin dependent diabetes. And so you may have that kind of back in the back of your head. The reason for that was because type 1 diabetes, it can develop at any age, but the typical onset is before the age of 30. And most people with type 1 are diagnosed early, like between the ages of 4 and 7 and 10 and 14. That was why they called it juvenile onset. The reason they called it insulin dependent is because people with type 1 diabetes have to get insulin from an outside source because they can no longer make it themselves. So those are the two reasons why they called it juvenile onset or insulin dependent diabetes, but we don't really call it that anymore. We just call it type 1.
So what are the symptoms of type 1 diabetes?
Well, Megan and I have symptoms that we call the 3 Ps. So polyphagia is the sciencey word for excessive hunger. Poly means many. So phagia means hungry. So polyphagia means excessive hunger. Polydipsia is the sciencey word for excessive thirst. And polyuria is the sciencey word for frequent urination. So symptoms of type 1, you pee more often, you're thirsty all the time, and you are hungry all the time. You can also have rapid weight loss. That's usually a common symptom as well. And these symptoms can come on pretty fast, like usually within just a few weeks to months.
And remember, a main function of glucose is to provide energy for the body. But without insulin to tell the cells to take up glucose from the blood, it just stays floating in your blood, and that leads to dehydration, and the cells feel like they're starving for energy.
So it really makes sense that you would feel really hungry, even though you're eating, and really thirsty, even if you're drinking. So polyphagia and polydipsia.
And then, of course, that increased thirst leads to increased fluid consumption, which leads to excessive urination, polyuria.
Because a glucose fuel doesn't get into cells to be used, the cells have to use an alternative. And these alternative energy sources would be fats and protein. It will break down body fat and muscle to get at the energy in these, resulting in unintentional weight loss.
Because those with type 1 diabetes cannot produce insulin, they have to take insulin for the rest of their lives. Insulin can be injected using a syringe, a pen, a pump, and the number of daily insulin injections is going to vary from person to person. And there are also different types of insulin that can be used.
And students always ask me why a type 1 diabetic can't take insulin pills instead of doing these injections.
Good question. Insulin is a hormone, and hormones are made of protein. When protein molecules hit the stomach, the acid there unravels the protein strands and they can't be put back together. So instead, the strands get digested and split into smaller and smaller pieces before ultimately being absorbed into the blood as amino acids. So the full hormone insulin would never make it to the blood. So instead, it has to be injected directly into the body, bypassing the digestive system.
That's really interesting.
I know.
Before insulin was discovered in 1921 and became widely available, people with type 1 diabetes died very quickly after symptoms began. The extremely high blood sugar levels affected brain function and eventually led to a coma. They called it a diabetic coma, and then possibly death. In fact, my husband's cousin, she had type 1 diabetes, and she died very suddenly in her 20s, and that was in the 1960s. Unfortunately, that could also be happening now. If a person is not getting adequate amounts of insulin due to a shortage or financial limitations, there can be severe health consequences.
The cost of insulin has greatly increased over the last decade. These life-saving drugs can cost anywhere from $100 to $500 per month if you don't have insurance, and many people don't have medical insurance. Some states are trying to cap costs, and Congress has been discussing it, but there's no national program yet.
Not yet. I've actually had a few students with type 1 diabetes who told me they were going to have to drop out of college because they couldn't afford both tuition and their insulin.
It makes me so mad.
Me too. The goal for every diabetic is to avoid large swings in blood glucose, either too high or too low. Diet definitely plays a role in this. There are several diets one can follow to avoid these swings, but all include eating a lot of non-starchy vegetables, lean protein, and complex carbs that contain fiber.
Registered dietitians and certified diabetes educators can definitely help with these changes. But those with type 1 diabetes must always take insulin to avoid hyperglycemia, which is a sciencey word for high blood sugar.
Hyper means high, emia means blood, glyc is glucose, hyperglycemia. Bouts of hypoglycemia, which is the opposite, low blood sugar, are also seen at times in those with type 1 diabetes and can be caused by injecting too much insulin or injecting insulin at the wrong time. Symptoms come on pretty quickly, and they can include things like shakiness, sweating, nausea, fatigue, irritability, confusion, and even seizures or, in extreme cases, coma. This can be treated by eating candy or drinking a juice box.
This is also a question I get asked about sometimes by students, particularly when we're discussing the importance of limiting added sugars for those with diabetes and really for everyone.
For sure.
But questions like, well, my grandfather has diabetes, but sometimes he has to eat candy. Why is that? Well, because keeping blood glucose levels in the recommended range requires careful monitoring. And if blood sugar drops too low, you need to get it back up. It's definitely complicated, and people with diabetes really have to pay attention to these levels and listen to their bodies.
Yeah, that is so important. Another question I get asked sometimes is fruit bad for people with diabetes? Can people eat fruit?
I get asked this too, to which I respond, as for most things in nutrition, everything in moderation. Fruit contains fiber, which helps prevent blood sugar spikes, as well as numerous vitamins, minerals, and phytochemicals. So it's actually recommended to consume whole fruits, especially instead of juices. But pay attention to total carbohydrate intake over the course of the day, and also pay attention to portion size.
Oh, exactly. So while type 1 diabetes is a serious disease, it can be managed. It's also far less common than type 2. It's estimated that of the 37 million people in the U.S. with diabetes, only 5 to 10% of them have type 1.
This means that more than 90% of people with diabetes have type 2. Unlike type 1, which is an autoimmune disease, type 2 is more associated with lifestyle factors.
Type 2 used to be called adult onset diabetes or non-insulin dependent diabetes, but this is no longer accurate because we are now seeing rising rates of type 2 diabetes diagnosis in both teens and even preteens, so not just adults, and also because those with type 2 diabetes may at some point require insulin as part of their treatment.
Type 2 diabetes is caused by insulin resistance. The insulin receptors in muscle, liver, and fat cells no longer respond to insulin signals. So in class, I always tell my students that they go on strike. The pancreas is still producing insulin, but the insulin receptors stop responding, which
that's such a good analogy.
I really like that one. I think it helps people understand
For sure.
So blood glucose levels remain high. The pancreas responds by pumping out even more insulin to try to get the receptors to accept the glucose. But eventually the beta cells may wear out and just stop making insulin altogether.
So how do you develop type 2 diabetes? Well, there are several factors that increase your risk. Smoking, being sedentary, having high blood pressure or high cholesterol levels, and carrying excess weight on your body. All of those can increase the chances of developing type 2 diabetes. And in fact, being overweight is the number one risk factor.
Other risk factors include having prediabetes, or if you've had gestational diabetes, being over the age of 45, being part of a minority population, or if one or more of your immediate family members has diabetes. In fact, it's recommended that people with any of these risk factors be screened for diabetes at least every 3 years.
Of course, if you experience any of those symptoms that we talked about, you should see a medical doctor. The onset of symptoms in type 2 diabetes is often much more gradual. I mean, it can take months to years than for type 1, and so they may be less noticeable. However, the symptoms are the same, including the 3 Ps, polyphagia, polydipsia, and polyuria, and unexplained weight loss.
But there are also some additional symptoms for type 2 diabetes to be aware of, including blurry vision, experiencing numbness or tingling in your hands or your feet, having sores or wounds that heal very slowly or not at all, and having more infections than usual.
The symptoms can come on really gradually, and that might be why approximately 8 million people have type 2 diabetes and don't know it.
Probably. Insulin is not always required for type 2 like it is for type 1, but there are several medications that can be prescribed for those with type 2 diabetes.
These meds, they work in various ways to help you control your blood sugars. So some help your body make and release more insulin, especially around meal times. Some help your body digest sugar more slowly, and some help the cells in your body use glucose better.
Some stop your liver from making too much sugar, and some also help the kidneys increase the amount of sugar that is excreted in urine.
You might be prescribed one or several of these medications based on your individual situation. But regardless of the medication that you're taking, making positive changes to your diet and exercise routines should definitely be a foundation of living with diabetes.
In fact, many people with type 2 diabetes can control their glucose levels with lifestyle changes alone.
That's really awesome when they can do that. So dietary approaches for type 2 diabetics are the same as those for type 1.
Eat more non-starchy vegetables, things like broccoli and spinach, whole grains, nuts, seeds, lean protein, and healthy fats like olive oil and avocado. And eat less foods with added sugars, things like candy, soda, sweet tea, and refined grains like white bread or rice that have very little fiber.
For sure. Exercise is also recommended and can be particularly beneficial for those with type 2 diabetes.
Honestly, this diet and exercise advice is good for everyone,
Definitely.
And not just those with diabetes.
The recommendation for exercise is to choose activities you enjoy and try to increase your heart rate for at least 150 minutes every week. That's about 2.5 hours. If you add in 2 days of muscle strengthening exercises that work all the main muscle groups in your body, that's even better.
People with diabetes should check their blood sugar before and after being physically active because there's something about exercise that helps make those insulin receptors more likely to take up glucose from the blood.
Another tip is to wear well-fitting shoes and socks to prevent blisters and sores or cuts. Wound healing slows when blood sugars remain high, and you want to avoid opportunities for infection.
Hopefully with a healthier lifestyle and or medications, those with diabetes are able to maintain their blood glucose levels close to the normal range to minimize the likelihood of complications. Uncontrolled diabetes can cause several significant negative long-term health consequences.
It's really important for those with diabetes to check their blood sugar levels regularly. They can use test strips and a glucometer, Or if they're lucky, they wear a continuous glucose monitor that sends their glucose levels directly to their phones. Game changer.
That is so true. And knowing your blood glucose levels in real time allows you to make immediate dietary or activity changes to manage those levels.
Yeah, I think it's making quite a difference.
Yeah.
As we mentioned earlier, most of the negative health consequences occur because of that extra glucose in your bloodstream that makes it thicker. Thicker blood means several things. One, it's more difficult for the heart to pump it. The heart wears out more quickly, leading to heart disease. In fact, heart disease is a leading cause of death in those with diabetes.
Thicker blood also means more pressure on the walls of blood vessels, leading to high blood pressure, which also increases your chances of having a stroke.
And thicker blood can get stuck in those small vessels, clogging up organs like the kidneys, blood vessels of the eye, or small vessels in their feet, legs, and hands. This can lead to kidney failure, vision loss, numbness or pain in your extremities, especially like your fingers and your toes, and wounds that heal really slowly or not at all. And wounds that don't heal can get infected, and that can lead to amputation.
Diabetes is actually the number one cause of new cases of kidney failure, blindness, and lower limb amputation.
That's really crazy.
I know. Other possible complications include increased risk of Alzheimer's disease, gum disease, skin issues, depression, sexual dysfunction, infertility, and more.
These all sound terrible.
They really do.
There is a little bit of good news, though. The rate of diabetes complications have decreased in the U.S. over the past 20 years. And by taking those prescribed medications regularly, living a healthy lifestyle like we talked about before, losing weight if you need to, and refraining from smoking, a person with diabetes can avoid those terrible complications.
Here's another comment that I hear about from my students about diabetes. My grandmother used to have type 2 diabetes, but now she has type 1. What do you say when you hear that, Susan?
I get asked that sometimes too, or someone will say that as well. I think that they believe the type changed because grandma used to be able to control her blood sugar levels with her medication and her lifestyle. But as she's gotten older, diabetes can change, and she now needs to inject insulin as well, usually just around meal times. That doesn't mean she changed the type of diabetes she has. It's still type 2. She just needs a little extra help from insulin. But I can see how that can be confusing.
Well, and I think that's left over from the whole insulin dependent versus non-insulin dependent.
Yeah, that's a really good point.
And gestational diabetes, well, it's very similar to type 2. The exact cause is unknown, but it's thought to involve the effects of pregnancy hormones on how cells respond to insulin. It can cause pregnancy complications like having a baby that weighs more than 9 pounds and an increased risk of premature delivery or having a particularly difficult delivery.
The good news is that gestational diabetes typically goes away when the pregnancy does, but there's a much greater chance that both the mother and the child will develop type 2 diabetes later on.
And we mentioned prediabetes earlier, which is when a person's fasted blood sugar is above the healthy level, but not yet at the level considered to be diabetic. It's like borderline diabetes.
But that's 96 million people, and having prediabetes also makes you more likely to develop diabetes later.
But that doesn't mean that having prediabetes or having been diagnosed with gestational diabetes, it doesn't mean that you're doomed to get type 2 diabetes.
Right. Lifestyle plays such a major role in diabetes development. So you could start eating a more healthful diet, exercising regularly, and reducing your risk in other ways to avoid type 2.
Okay, well, we hope we've answered some of your questions about diabetes, one of the most common chronic diseases in America. Let's bottom line it.
Okay, bottom line. Diabetes impacts all social, economic, and ethnic backgrounds. Almost half of the U.S. population is either pre-diabetic or diabetic, even if they don't know it. Type 1 diabetes is an autoimmune disease. It cannot be prevented and requires lifelong insulin injections. Type 2 is far more common and is strongly associated with poor lifestyle choices. It can run in families, and if a woman has gestational diabetes, both she and her child are more likely to develop type 2 later.
The goal of diabetes treatment is to maintain blood glucose within a normal range and includes medications, diet, and exercise. Uncontrolled diabetes means that you're unable to do that, and that makes you susceptible to several negative health consequences like heart disease, stroke, kidney disease, blindness, amputations, and even death.
But there is hope on the horizon. The number of these complications is declining, and with new technology, like continuous glucose monitors, should continue to decline even further.
Thanks for listening, everyone. We hope you've learned a little something about one of the most common chronic diseases in America. Don't forget to rate and review us on Apple. It really, really helps.
Yes, and please join us next time when we answer the question, how can I prevent food poisoning?
Class dismissed.
We hope you enjoyed this episode. You can find the show notes and a list of sources on our website, yournutritionprofs.com.
Your homework is to follow us at Your Nutrition Profs on Instagram and to listen to our next episode. You can listen on Amazon Prime, Apple Podcasts, Spotify, or anywhere podcasts are found. We'd appreciate it if you'd like us, write a review, subscribe, and invite your family and friends to join us too.
If you have a nutrition or health question you'd like answered, let us know. We may do a show about it. Send an email to yournutritionprofs@gmail.com or click on the Contact Us page on our website.
Thanks to Brian Pittman for creating our artwork. You can find him on Instagram at BrianPittman77. See you next time.